being here and to share your courage. You've personal loss. And I don't know that any family is more than 1 or 2 steps removed from this loss. To hear personal stories of people that have lost a son or a daughter or a loved one because of this deadly poison, that just 2 milligrams can be a lethal dose. For context, that amount would fit the tip of a pencil. And there's no quick fix here. That's why I've had these roundtable discussions and wanted to have one here in Chautauqua County. And it's going to take federal policy changes and buy-in from local officials and the hard work of our police, our first responders, and our recovery specialists. Since taking office last year, I've co-sponsored a number of different pieces of legislation to tackle the fentanyl crisis. And the primary bill is the HALT Fentanyl Act. This legislation would make the temporary class-wide scheduling order for fentanyl-related substances. It makes it permanent. And it gives our law enforcement agencies the tools that they need to keep these extremely lethal and dangerous drugs off of our streets. This legislation, we were proud to pass this back in May. Here's the problem. We passed it in May. It still sits in the Senate with no action. This is sitting on Mr. Schumer's desk. He could move it onto the floor, take action, and I believe the president would sign this into law. This is not controversy. This is about moving the ball forward and sending a message loud and clear that we're tackling this crisis. It's a 50-state crisis. We can't afford to stop here. Tackling the fentanyl crisis demands a collaborative effort. In these discussions, I have found very helpful because officials getting together to have this conversation and in the firepower we have here in this room, that sends a message to the public about what the seriousness that we all take this. This isn't something we brush under the rug. We have to make sure that everybody is aware of the threats of fentanyl and the deadliness of many of the drugs that are on our streets right now. All levels of government have to be at the table here. Law enforcement, healthcare professionals, community partners, and organizations. We must work together to implement a comprehensive strategy that encompasses prevention, treatment, and recovery. This is cut against every walk of life. The wealthiest people in the community have been hit with this, the poorest people, rural, suburban, urban. No one is spared. I've heard stories in this tour around my district from first responders that have revived people in their 70s and then, teenagers of 15. No one is spared from this. And as we continue this roundtable discussion, I'm very interested to hear from all of you and what your experiences are, what you believe we need to work together with in towards as you've tackled in your own way this crisis here in Chautauqua County, and what solutions that you would believe can be attainable and a positive step in the right direction. Your insight and your experience are invaluable as we shape public policy, and having these discussions and meeting with this many stakeholders. This makes me a better federal representative for this community. Hearing people that have been on the front lines, have had to tackle this, as we have a county executive that's had to revive someone and bring them back from the dead with Narcan. Narcan's a miracle, but it's being taken to its limits. As I hear stories of people having to use 7 doses of Narcan to bring somebody back. At this point, I think it's, I'm going to turn it over to the county executive to kind of get some introductory remarks, and then we'll hear from our sheriff, and then go into the next step.
No, I think the congressman's right, and I think we all have talked about this before. I'm a little bit more on the hard side. And I don't know, maybe Kim probably wouldn't be opposed to what I say is, I don't know why people that are caught selling fentanyl are not charged with attempted murder. Fentanyl is not used, in a clinical setting, it's used to be a pain reliever. On the street, it's not. It's meant to increase the high, and it's done by chemists and people who may or may not even have a high school degree. And they're putting this stuff with drugs that have no intent to, let's see how high we can get you. Oh, you died. Well, You think the marketing strategy of the drug cartels wouldn't want to be to kill off their clients, right? But a couple years ago, Cattaraugus County was the first county in New York State. If you ever happen to catch an episode of Blue Bloods, they called it Cattaraugus County, but they were the first county that ever indicted somebody on a murder charge for an opioid overdose. That has to happen more often. I mean, these drug dealers are selling drugs that, they don't know, but they don't care either. I understand the disease part of this. But these dealers don't care for our people. They don't care for our children. They don't care for our loved ones. And as we've said, Steve could tell us, we've OD mapping. We've revived the same person over 8 times in 1 year. Now that's revived them 8 times, not how many doses of Narcan have we used. And the other side of that is, we don't give out EpiPens. EpiPens are $600 plus. That's anaphylaxis. You're born with that, or something you acquire, and the doctors would agree or refute what I'm saying. But EpiPens, insulin, those are all high cost items to patients. But that's something they're born into, or type 2 diabetes. Maybe you've acquired that. But this Narcan, I remember in the ER we'd use it once or twice a summer. It's multiple times a day now. And there needs to be a pivot. There needs to be a change. We need to make a hard line. And I know that's hard for people that are in those addictions and that are trying to come out of that. But if we don't take a harder stand from the federal government on through the state, we're just going to perpetuate this. We've all been here. We've all been not victims. We've all seen DARE, right? How many times have we had different drug education programs across the United States and across New York State? It's time. I think we need to take a hard stand, and with the Congressman's help, I believe we're doing that. It just has to get pushed, in the Senate, and we really need to get this stuff off our streets. There's no 2 ways about it.
Well, you bring up a very important point that these roundtables have brought us to, which is, the criminal justice system in the state of New York. And I'm eager to get the law enforcement perspective, on that. We'll start off with our great sheriff, Jim Quattrone.
Well, I look at this epidemic as Kim mentioned, and we need positive change, and we get that positive change through a holistic approach. Congressman, you talked about the importance of treatment, recovery. We need education and prevention. We need enforcement. I think this bill is the helps us with the enforcement. But if we don't all work together, we're not going to win this. And unfortunately, the title that we've seen for now going on 60 years is the war on drugs. I would say that we have lost that war. We've seen way too many overdose deaths. And until we are willing to work together and kind of get out of our silos, it seems that happens all too often. I look around this room and the support we have here and the resources that we have in Chautauqua County are awesome. We now need to really educate and allow people to know how to acquire those resources and utilize those resources, and get rid of the stigma. Way too often, as you mentioned, is this reaches across all socioeconomic backgrounds, ages, career fields. We probably all know people. I go back, probably the information I've learned the most about overdoses and addictions are from 2 family members who unfortunately died of overdoses. But prior to their deaths, they taught me a lot about the issues. And one of the things that they told me is question everything I tell you. And I said, won't that get you mad? Well, I said, yeah, that will, but you need to question everything we tell you, because so often people who are struggling with addiction are great manipulators as well. I know there's sometimes frustrations with the use of Narcan, in different segments. First time I used Narcan was on a young man, and I was told by the fire department it was his 5th time. I later, as I mentioned, my family member was in rehab. I went to visit him, and that young man was at the rehab. And he came up and thanked me, told everybody who I was, even though I was trying to stay anonymous. And we had a discussion, and he did say it was his 5th time. He has been clean since. So we don't know at what point
somebody is going to really accept the help. And I think that's part of it. So I thank everybody for being here. It really does take this type of community to make the positive impacts, positive changes.
Well, and you've been doing it for years, as Megan Schmidt and I can point out, you were our DARE officer when we were young students at Pine Valley.
I started teaching DARE at about age 5. I'm not even sure, somebody we talked about, I think Investigator Bucket, we talked about the importance of having programs like that. And I think Prevention Works has some great programs and they're into the schools. We need to just build on that. When you look at the amount of money that's going into incarcerating people, if we could balance that a little bit and get the treatment dollars out there and the prevention dollars out there, and it's going to take a while. It's not going to happen overnight, but we need to work in that direction.
Great. Would the Jamestown Police Department love to get your perspective as we open up the law enforcement side of this?
I mean, I agree with a lot of things that Sheriff Quattrone was saying. Frankly, the law enforcement side it's very difficult because of nobody stays in jail. When we do lock somebody up, bail reform has essentially allowed anybody to get out after. And I'm not just saying drug dealers, it's the users too. So the good thing about keeping them in jail is that they're not going to have access to the fentanyl. I can tell you that there's at least 10 people out of the over hundreds that I've investigated the deaths of that had they not been let out immediately like they were, they'd probably still be alive, or at least would have had a chance a little longer. They died immediately after they got out of jail within the 24 hours of an overdose death. So I mean, I would say that's our biggest frustration with it.
Well, the bail and discovery reform, not being able to hold people for any sort of bail, that just naturally takes potential informants, takes people out of the equation. And as I've spoken to judges and representatives of the DA, around my district, I mean, they say that maybe a third of people actually come back for their court appearances at this point. In terms of fentanyl specific crime, I mean, are you seeing any sort of themes as to how the fentanyl has come into Chautauqua County, Jamestown specifically?
Trying to think of,
or is it just is it going across all segments of the drug portfolios?
I mean, it is. We don't have many people that are directly connected to cartel, but we do have people that are connected to cartel in the city of Jamestown. A lot of it is being shipped in through the mail. So that's, I would say, one of our biggest hurdles is the U.S. Postal Service has almost zero investigators to actually try to prevent that from happening. And when we tell them about potential houses or people, they basically say that they are so inundated with Buffalo, Rochester, and other larger cities, they can't help us. So it's not on them, and I'm not trying to throw stones at them. That's just the fact of the matter is there's not a lot of resources in that. And there's a ton of fentanyl being shipped in through the mail.
I had not heard that in any of our other discussions. So that's actually very helpful to know, because if this is happening here, it's happening in a lot of different places. That could be one of the ways that we federalize some of these investigations. I think earlier this year I met with the chief in Jamestown, and he said that they try very hard to bring federal charges on anyone they can because then they can hold potential dealers for bail. And that helps. There's just not enough federal resources in terms of federal law enforcement in the greater, Buffalo, Western New York area to do every one of these cases. Nor does it, meet the threshold. So I think that we should be looking, and some of my colleagues find ways to keep the federal government out of the state. Sadly, I think in New York, we sometimes have to find federal workarounds to get the state to do the right thing. Because the overreaction of bail reform has really taken away many of our law enforcement officers' ability to do their job. And we need to give people the treatment that they need so they hopefully don't, become victims again. But the perpetrators, as our county executive laid out, we need to be really putting teeth to these crimes, because the revolving door criminal justice system has made this scourge so much worse. What kind of recidivism are you seeing in terms of people, constantly being nailed?
I mean, I don't have the exact numbers. I'm sure I could get them, but my just guess would be 90% or more. I mean, I'd like to say 100, but nobody likes to hear 100. So 90%.
Yeah. How about from the Dunkirk perspective?
We have houses we've hit several times in the course of months. I realize that rehabilitation and treatment programs are a major part of what needs to be done, but I want to talk from the enforcement end of it. We put, as Alex and Troy will tell you, 6 months, year into investigations into these drug issues that we have, manpower, resources, equipment, and we take our tactical teams and we knock their doors in and we take them to the station. If we're lucky that we can get enough weight to make it a felony, we can hold them till the morning when they are always released. The majority of the time they get an appearance ticket and you get to walk back out the door, back into the same neighborhood that they've destroyed, back selling to our children and destroying our communities. I'll equate this to, fire chief will appreciate this. If you have a fire and you just spray the water over the top of it, chief, is it going to go out? No, you need to hit the base of it where it's happening, and we need to hit these drug dealers hard, and they need to go to jail. Not saying that's going to solve the problem, but if we can make them be in jail, that means they can't sell this stuff on our streets and destroy our communities.
It's, a system without consequences breeds chaos. And when you have no penalty, and people that will commit crimes will commit more crimes. And if there's no punishments attached to them, there's no incentive to stop.
We have one house in our community twice, and was it 3 months, Alex? First time we took 17 people out of it. The second time we took 13 people out of it. It's not working. And that's an issue that we're having.
Investigators want to add any thoughts?
Couldn't agree more with Lieutenant and the Chief both. It's something that we have seen in the county, particularly like the Lieutenant was saying, with users and dealers. We have people that have been linked to numerous overdose deaths, and as the laws are written right now in New York State, those are tough cases to prove with the way the laws are written and structured. So they're getting charged with serious felonies and they're getting out of jail 45 minutes later. And they're linked to numerous deaths. And it really is a public safety emergency when these people are just getting out, and these laws that I'm sure were well intentioned are making it worse.
It's been a theme I've heard everywhere in our district, and what you're sharing is no different than what we've heard
in our bigger cities, as well as our smaller towns. We have our chief of Ellicott. Would you like to share any of your thoughts?
Well, I couldn't really say more than my colleagues have said, but we feel it a little harder. We're part of the Jamestown Task Force. The sheriff has helped us for many years. Our town surrounds the city of Jamestown, so there are no boundaries. It trickles over. We get it. We do the best we can. We got to rely on them to really help us. And I mean, they're inundated also. So we feel it maybe more. I mean, we have smaller numbers, but we feel it. It's difficult. So again, enforcement, Chief Ortolano said that's what we need to do. We've got to change that first, I think.
So just, walk us all through this. If someone gets caught selling a fentanyl laced drug, I mean, how does that arrest work? I mean, what are they gonna get charged with
Well, it depends on weight.
Depends on the weight. They would get charged with criminal sale or criminal possession of that drug, but depending on the weight as to what level of felony it arises to.
And at what point does, I mean, because the governor, got some fix on bail reform on dangerousness. Does any of this apply to the fixes that they put in?
Not really.
No,
No.
drugs were not,
Not.
drug dealers were not enraptured in that.
I mean,
So-
not only fentanyl, but it's all drugs, cocaine, whatever else we deal with, meth. It's the same across the board for all illegal narcotics. The enforcement teeth just isn't there.
So, someone's got 10 pounds of cocaine in front of them, you can't charge them any harder than you could if they had.
Sure, yeah, with the weight of it, depending on the weight, but the majority of the time, we can hold them until they see the judge, usually the following day. In the cities, we have holding, so they'll see our city court judge the next day if it's overnight. If it's during the day, the judge will see them immediately. But because of the restrictions that are put on our judges, the majority of the time, they have to release them what is called in New York State, the least form of restrictive bail, okay, which doesn't leave them a lot of leeway. At least if our judges had some more, our judges are elected by our communities to serve what's best for our communities. And for lack of a better term, they're being handcuffed by state bail reform laws that don't allow them to do that.
No, it's, somebody's got to wake up. I mean, because we have, I'm interested in all of your perspective on how this has affected, say, drug courts. From at the end of the table, anyone have any, by getting people into treatment to get them to break the cycle here?
From the treatment perspective, we are open, ready, available, and waiting. We have lots of openings on medication assisted treatment or medication for opioid use disorders. We can pretty much get next day assessments scheduled and executed. We have, I would say, at least 1/3 of all of our assessment appointments are canceled and rescheduled. They're started, half the process is completed, and we don't hear from people again. So obviously this is a multifaceted issue, but from the treatment perspective, the hook is so strong with these drugs that people are using that it's really hard to engage and to keep that engagement going. And we continue to work on lots of collaborations within the county to develop new and interesting incentives. But again, I mean, we just continue to try. I don't know if that answered your question.
No, it was just, I guess, some of our drug courts in the past were, had great success stories about getting people into treatment, breaking the cycle, and then with bail reform, coming down, not having to follow through with their drug court convictions, was preventing people from going through.
It has become a missed opportunity. Obviously, if no one's sitting there waiting to be processed and thinking about where they're at, I think that the drug courts have lost the ability to strike and offer deals to get people to think, maybe I should make a different choice. Maybe I should go into long-term treatment or at least start inpatient where, they're pulled out of their environment for a moment to pause that and allow the treatment to work. So yeah, I think that with bail reform and with out the ability to hold these people, we're missing that opportunity.
I think the sheriff would say that unfortunately, and our treatment facilities are also the same. You could voluntarily walk in, but there's nothing to keep you there.
Exactly.
You know, since the state did mandate a medically assisted treatment, thank you for the legislature and Dr. Falk and Dr. Walters for implementing that. The best treatment we have, no offense to anybody under the table, is right across the street. You know, that's a place where they're incarcerated. They're in an environment where they are mandated to make that treatment happen. And that's the frustration, you know, like Megan said, and I'm sure UPMC will tell you the same thing. The doors are open. We'll take as many people that want to come in, but there's nothing that keeps them there. They can walk out the next day and say, I'm better. I'm out. And again, it's a Megan, you're so right. The addiction is so powerful that unless you're forced to be there, it's hard to get yourself back.
Why don't we go to our public health director for a little context?
You know, I think that we, in the county executive, we have to recognize all of the really important work. Between our, law enforcement officers putting their lives in the line every day, our EMS providers and our hospital emergency departments and hospital workers up all night taking care of these patients. All of our community partners that are involved in our Chautauqua Substance Abuse Response Partnership that meets monthly. In fact, we're meeting this afternoon. Our correctional health, nurses, medical team, corrections officers. Without that work, I'm convinced that our overdose death rate would be 3 to 5 times higher. And it's not to discount the problem. It's just to recognize that we are saving lots and lots of lives. Although we want to get to the point where we don't have to tell these stories anymore, right? We know that this is a demand problem. And I think that's probably the biggest frustration from the our law enforcement partners, is they can't arrest their way out of this. It's a demand problem. As long as the demand is there, we're going to have the supply one way or another. But as Chief Orlano mentioned, it's like just put the fire extinguisher on, putting out little fires here and there. And I think what we don't have a really solid understanding of is what is the root cause of the addiction process. We have some ideas, but there really isn't a lot of what to try to understand what is the root cause. A lot of socioeconomic, environmental factors obviously play a role. Are there genetic factors that we could identify with DNA technology and things like that could trigger an intervention at a young age? All of those things, I think there's a lot of opportunities there to really get to the root cause of the problem. The other thing is especially with recent legalization of marijuana, huge priority. We have to protect our children's rights, right? Whether it be alcohol, sedative medications, opiates, vaping, other tobacco products, we have to protect our children's rights, and marijuana is included. Once those addictive pathways start, that's when it all begins. And so, can we employ our our pediatrics offices, our counseling clinics, all of those that are involved with our youth, to identify those at most risk for addiction and get those folks to the help they need quickly before they start off.
Can I speak on that? I just want to ditto what Paul said. I mean, it takes so much to get somebody off of addiction, but so much easier to prevent. And just from a money standpoint, prevention is not seen as glamorous. So when there is a crisis going on, we focus on the crisis, but we don't focus on how can we prevent them from happening from the beginning. Just to give it in perspective, when I first started in this position, our regular funding from Oasis was about $385,000-$90,000. It's gone up $50,000 in 7 years. Yes, we get other funding from grants which are great, but it's not sustainable. We would love to have one full-time person in each single school district to provide intervention services. We have a program, Teen Intervene, that is for students that are using mild to moderately. And that is a great place to start. If they're starting to experiment, they're starting to vape, they're using marijuana. I 100% agree with marijuana. That has increased in our youth substantially. The vaping concerns, things with lace with THC, it's astronomical. And it's Kim and I were having a conversation. Like eventually that THC and that marijuana is going to come flat. They're going to build that tolerance up and they are going to need something else. And that might be heroin, fentanyl. But it starts with our kids. I can't stress that enough, but unfortunately, a lot of dollars are going towards crisis and not putting it towards our, and it's just going to keep happening. It's just going to keep happening.
Kim, did you want to?
I did, because, thank you. You know, when Alex died, I went on a quest to understand as much as I possibly could. And I'm not ashamed to say that I am an alcoholic in recovery, and I have been in recovery for a long time. I know a lot of people who have made it to recovery. I have. But had there not been some very humbling experiences, I don't know that I would have found it. Maybe I would have. I can't say because I am here. But I really needed to get in the so-called gutter to learn and understand. And we're talking about two different people here. We're talking about the dealer, who generally doesn't use, because if he did, he'd put himself out of business. And the user, who probably started with something else at a very young age, realized that there was an escape from something. But when that something didn't work, they went on to explore other things. I know that it was a very small amount of fentanyl that killed my son, Alex. So when we're talking about weight issues and we're dealing with something as micro small as the end of somebody's pen or pencil, how can we say that it depends on the weight? It is my opinion, and I feel that I have spoken to enough parents and enough other people in our community to say that if you are carrying a deadly substance known to kill people, when you get caught with it, you need to go to jail. And you must stay in jail. Because there are other people that are going to die in the wake as soon as you get back out there. And I also know that when one dealer drops off for a couple of hours, there's family members right there to pick up the slack. And they're going to keep that person employed. And it's almost a joke to be in New York State. People aren't held accountable. I was pivotal in bringing very good housing programs for people in recovery. I would urge anybody at the table to look up Oxford House Living. We were taking people off the street who wanted recovery 10 at a time, putting them in a situation where they had access to good recovery. And it all hit the pavement when the bail reform started, because without drug court saying, if you use and you put these other people in jeopardy, we're going to put you in jail. When you take that away, we had trap houses on our hands and they had to be closed immediately. Therefore, housing for 20 people, which doesn't sound like a lot, but it sounds like a better option than what we're seeing at the Faulkner Motel and at the motel in Dunkirk, New York. And if we don't look at this as the crime that it is, if you're walking around carrying a loaded gun and you're not supposed to have a loaded gun, y'all are going to try to get that person off the street, aren't you? And yet they're walking around with fentanyl, a known deadly substance. And they get an appearance ticket. That's a slap in the face. Every police officer in this room puts their life on jeopardy the minute they kiss their family goodbye in the morning. And somebody's going to get an appearance ticket? We're lucky to have the police officers that we have. Because I don't know if I was a police officer, if I would keep putting my life in danger for what? So they can get out. Treatment's come a long ways. I've always said, if you want help, we have help. There is help here. I personally have a fund at UPMC, and I'm darn proud of it. So you've got a handful of good treatment, but you've got 25 dealers shoving it into the faces. And if you've ever seen somebody suffer from withdrawals from heroin, trust me, that person would like to die because it's ugly. Dealers aren't stupid people, but we've got to get a handle on this because it's not going to stop. They are here and they need to go to jail because we have lost way too many good people.
Thank you. Very well said.
Sharon.
Very
What's
well
well said is I've heard anyone in with obviously the loss that you've suffered. You know, you speak with a lot more authority than most that talk about it. And I know that our state representatives, you know, Andy Goodell in the Assembly and George Borrello in the Senate, I mean, they're on the right side of this issue. I've certainly advocated against this bail reform since Andrew Cuomo brought it into law years ago. I don't understand how they cannot see the error, as we now have plenty of data. You know, the first day that it happened, you know, we told everything we said would happen. You know, when someone robbed a bank, they took them in, gave them their appearance ticket. This happened in Albany, New York, and then they robbed another bank in the afternoon. You know, that's exactly the kind of thing we told people would happen. When criminals have no consequences, they commit more crime. And you're talking about, you know, in all the facts and figures and citations that you bring forward, taking people's lives. And, you know, our youth and our kids, that, you know, that this can steal a whole generation. And there's too many families, you know, including many in our community, in your household, that had an empty seat at the table over the holidays. And there need to be consequences for the people that push this poison onto our communities. And so I'm going to do everything I can at the federal level. I mean, in fiscal year 2023, I mean, it's important for us to realize that this is not, you know, you're all doing things at the local level, and that's so important because you are dealing with the street level consequences of this. But this is a global crisis. We have the Chinese manufacturing this poison. There's as many as 2,000 chemical plants in China. America has maybe 200. There are plants that exist just to create this fentanyl to sell to the cartel. They manufacture it cheap, and then the cartel mules it into this country. And it's a further testament to the fact that the president's administration refuses to secure our southern border. And we will be tackling these issues when I return to Washington, and bringing some brinksmanship to these issues at the southern border. I mean, we've had a population come into this country that is greater than the population of 17 states. And we've caught over 200 at the border from the terrorist watch list. And there's, you know, almost 1 million that are called gotaways. We don't know who they are. We don't know what their intentions are, what country of origin, but we know that they've escaped into the interior of the country. And, you know, where the cartels are now using mail. We're in a war not against street level drug pushers. This is an international multi-billion-dollar conglomerate. They have tools and weapons and technology. You know, I spent a whole day over the summer with U.S. Border Patrol at their office in Grand Island, the Buffalo sector, which is called the Buffalo sector, but it goes from, you know, our northern border, but it goes all the way to Virginia. And, you know, being with these law enforcement professionals, these experts in this crisis, I mean, they had to spend years on the southern border before they get a detail on the northern border. And, you know, when I asked them about this immigration crisis, I said, how many of these people will actually get asylum when they get their dates in court, which are in 2026 and 2027 and 2028? They said 8 to 10%. The rest are just going to be here, and we're never going to find them again. And it's in the millions. But when you let that many people in without vetting, without proper enforcement of U.S. law, you get bad actors. And the cartels are using these people coming in here, and oftentimes the media wants to portray this as this humanitarian crisis. We have just decided to not enforce our southern border law. A country without borders is not a country, and it cannot be secure. We have to enforce the southern border. We have to tackle this and get our hands around this war on fentanyl at the border. This HALT Fentanyl Act it's important for us to make permanent these classifications. I've also co-sponsored the Stop Fentanyl Act, which reduce the quantity of fentanyl that triggers a mandatory minimum prison term for high-level offenders. Specifically, the bill would bring the threshold to trigger a mandatory sentence down to 5 grams of fentanyl from 400 grams of fentanyl, down to a half a gram of fentanyl analog from 100 grams. This is necessary to stiffen the penalties for a substance which is Kim brought up. In very small quantities can kill hundreds of Americans. A sugar packet can kill the whole city of Jamestown. I mean, this is the weight of this is like a drug like we've never seen before. And as it gets laced into other substances, it becomes more and more dangerous. And I've also co-sponsored the Stop Our Scourge Act of 2023, which would designate illicit fentanyl as a weapon of mass destruction. We know that the cartels that are smuggling these deadly substances into the United States, and we know much of this is made by the Chinese, which is our greatest adversary domestically and internationally. And it's clear that this administration hasn't taken the threat seriously on what the impact has been on all 50 states, on towns large and cities large and towns small. It's hit every walk of life, as we've talked to, but this bill, if passed, would force President Biden and Secretary Mayorkas to take it seriously. And we need to use the laws that are on the books in addition to passing new laws. This is just another challenge, for any of our local officials. And just want to give the opportunity. We have 2 brand new mayors who I'm really looking forward to working with. Kim Eklund of Jamestown. Would you like to share any thoughts?
Not really, but too much intense. Obviously, I'm not new to government, but new to the mayor's seat. I've worked with Lieutenant for a long time and some members of the sheriff and all that. And as a personal friend and advocate for Kim and strong supporter of her mission is very important, and her message is very important. And agree, it's a multi-pronged approach. It's a multifaceted animal, and sometimes it's the elephant in the room nobody wants to hear. In mentoring youth for 20 years, I have seen what you speak of. There's kids that voluntarily smoke weed with their parents or their grandparents because it's cool, and parents allow it. So I firmly agree that we need to get into the schools and into the youth to really decrease some of these other things that they're seeing. Truly appreciate the work of everybody in this room, but especially law enforcement and you for these laws that hopefully will come through, because I have a family of law enforcement and a family of first responders, and it's not an easy world for you guys, and it's the things that are making it harder for you should not happen.
Mayor Kate, I'm gonna be able to pronounce your last name perfect very soon.
Everything that's around the table, really in visiting with some of the drug treatment facilities and hearing the stories from the people that are providing services. The fentanyl is laced into every aspect of every drug, and the chief and I were just talking about it on the way up here, and a lot of it is coming from China directly to the mail, and we don't even know that it's here. So we really need to step up our policies and make sure that our first responders and our citizens and residents and children are protected.
It's every community is a border community now and fentanyl's brought it onto our doorsteps. I mean, I appreciate the state of emergency that County Executive Wendel declared that, against, resettlement, here in, I feared for my congressional district when New York City, with its sanctuary city laws, said, oh, we're full, we want to send you upstate where it's a lot cheaper. We have a lot of, broken down hotel stock, and, it's a lot cheaper to house people in upstate New York, but, we don't have the infrastructure. And, these two issues go hand in hand. And we have to protect our communities at all costs. I'm interested in law enforcement's perspective on how to tackle, one, you have multi-pronged approach. You have morale of your force. Keeping your officers safe. I had Elmira PD tell me that, they came across a house where they were cutting the fentanyl out in the open, and, one of the officers had to be Narcan because of exposure. And, our men and women in uniform, whether it be first responders, firefighters, EMS, or police, I mean, you never know what you're going to come across as people are facing their darkest hours. But, the fact that, your life could be on the line because of just coming upon a dealer house. Has anyone in Chautauqua County law enforcement faced any of these sorts of threats to our officers?
Everybody's
I
looking.
thi- I think Jamestown has, I'm looking at that.
Yeah, we specifically did. We did a raid. It was only a month or so ago. And the person inside was doing everything he could to destroy the evidence. So he was running around the house frantically, throwing it in the air. Our officers that were clearing the residence to deem it safe, they got exposed. One officer went to the hospital. Two of them got treated by Jamestown Fire, and they were okay. Luckily, nobody needed Narcan, but there was definitely some exposure. That person ended up getting charged with a significant quantity of fentanyl. I believe he's going to have federal charges as well. It was over 19 pounds of fentanyl / water compound. And then just before that, a few weeks prior, there was a female in our city jail, and they suspected that she had concealed some drugs on her person, if that's the best way to put it. And then she, when they went to search her, she pulled the drugs out, and it basically was another plume of fentanyl in the air. And I believe 4 of our officers got exposed to that one. At least 3, if not all 4, ended up going to the hospital for that as well. And thankfully, the fire department's right there and close and quick, and everybody's safe and sound. But yeah, we're constantly dealing with it. But I will say that, everybody says this thing about law enforcement, and it is what I hate to say what we signed up for, but we know these risks to an extent, and we do it for our communities. So we're not, frankly, we're not going to stop. And like Chief Ortolano was saying, we're going to keep coming, and we're going to keep coming, honestly, probably harder than ever. So we'll do the best that we can. That's what I'd like to say to the drug dealers.
Your sacrifice is greatly appreciated. I want to spend my time in Congress, and make it crystal clear, and I try to with every, speech or stop or whatever. I mean, we need to support with public policy the men and women in uniform, whether it's defending our country abroad, but also in the streets of every community here. You know, whether it's out there fighting for grant money for, you know, to help you have the tools to do your job better, whether it's equipment for our firefighters or more manpower on a police force, but also backing it up with public policy. And I don't believe we've seen that out of our state government. We've certainly seen it out of our local officials that have advocated against those downstate policies that have crippled this criminal justice system. But we need to have your back. And because your lives are on the line every day, and your families make that sacrifice, and I appreciate you saying that that's what you signed up for. But you have a very unique line of work where you don't know what the day is going to bring, and the least that the policymakers can do. And I think you great representation in Chautauqua County, but we just need that to be a little more contagious in the other 61 counties of this state. But to put those people in uniform first, so they can help everybody else. Yes, sir.
If I may contribute here, just a bit of context. So first, thank you, Dr. Paul, for really just commending the work that you all have done locally and are continuing to do. It's been an encouragement to me as I've come into this role to see how dedicated all of the individuals are in our community and all of the organizations really across the board. Organizations that I think we typically necessarily have at the table are passionate and dedicated to this as well. So I'm so proud of our local communities now. And I'm so glad to hear Congressman you talking about the policy level approach to this issue. And so while we have you at the table here today, would love to discuss that a little bit more. I think that's probably a realm that traditionally, public health hasn't necessarily been in that conversation, but it is a place where we need to be, because policy intervention is really what sets us up to be able to do the types of systems and environmental change work that needs to be done in this area. We talk so much about substance use and abuse, addiction from the individual standpoint. But so much of it is disproportionately happening in specific environmental areas. So we talk about the opioid exposure. Of course, that is affecting every demographic, every age, but disproportionately the distribution is occurring in specific areas throughout the county. So you do not see distribution happening in other, more affluent communities. So really you can attribute that to a number of different socioeconomic and poverty related issues that we see that will be on substance use. So our housing, the aging housing stock, decrepit and falling apart buildings and things, those things very much signal exactly the areas and spaces that the distribution is occurring in. And that's something that we have a particular interest in public health, because we see the poorest health outcomes coming from those same areas. So focusing policy, focusing intervention level around the environmental, the built environment in our communities is only beneficial across the board. Not even just with opioid use and the opioid epidemic, but substance use across the board and other health outcomes. And I think it's particularly unique because typically you don't see with these public health challenges that we would normally approach. You don't see so specifically how the environment is tied to the individual behavior like you do in opioid use. So we know how addictive opioids are because of the biochemistry. So much so that even when people spend copious amounts of time in treatment, the environmental triggers that occur, they can be out of treatment and recovering very well and walk by one street sign that they can always walk by when they use, and it immediately re-triggers their addiction. And that's so often then why you see the overdose death after somebody who's been out of treatment for so long, because the amount of fentanyl that they were able to, or heroin that they were able to use, prior to their rehab is now all of a sudden deadly to that same individual, all triggered by the environment that they're living in. So that's of particular interest to us is that broad sweeping improvement in our community planning, in our housing stock. We have the oldest housing stock outside of a few small neighborhoods in New York City, in all of New York State. It's contributing to major lead exposure for our children. These were the same children that tend to go on to actually experience drug use throughout this in St. Paul's, compounded by the lead issues and the developmental challenges that occur from those that exposure as well. So, what we can do from policy, environmental, and systems change around opioid and drug use will help exponentially improve the health outcomes for our community across the board. So, I applaud your efforts in the policy level approach to this, and we want to come along and be a voice of support for any of that in whatever way we can.
Well, we have to, obviously poverty issues are serious. I mean, this congressional district, which, spans from the very northern part of Erie County all the way to Watkins Glen. I represent 6 counties in the southern tier. And it's no secret, we've lost population, we've lost people, they've gone elsewhere. We've lost, some of our, manufacturing might that we used to have and great jobs. And it's, we have to do everything we can to restore, a vibrant business community, bring, investment to increase the housing stock and to turn things around. This can't be just something government does. I mean, we have to get a private sector would be unleashed if we had the public policy to match. And unfortunately, the business climate doesn't exist in this state because of too many regulations and too high of a tax burden to attract a lot of these employers without trying to buy them off. And that's sadly, that's been the New York State system for far too long. We have to reverse the curse, and eventually someone's got to wake up and say, oh, this is why we aren't as great as we once were. We lose too many opportunities to, we have a tough enough time competing with Pennsylvania, let alone our southern states that are exploding. I mean, New York once had 45 members of Congress. It now has 26. And there was a story last week that if the current census data, because the census data was released about all 50 states, if we had to redistrict again and reapportion the members of Congress for the whole thing, we'd lose 3 more, which would be the greatest, steepest loss in the history of New York State. People are leaving, states that, the economic burden is too high and they tax too much. And we're certainly not getting the bang for our buck as we deserve. And our challenges are great. The challenges, it gets very expensive per person to tackle a lot of these issues, and they are going to be systemic. And a lot of things are driven by poverty. A lot of things are driven by mental health. That's something we haven't quite touched on yet here. And I'm hoping that, Carmela, you can help us a little bit, kind of bring things into focus on, what some of the mental health issues, not just in our community, but overall, how that's working, to exacerbate this problem.
Oh, it's multifaceted, as everyone has stated. And I also want to echo what Dr. Fox stated, everything that we have done and we continue to do here as a community, especially with law enforcement, when it comes to our pickup orders. I would say our biggest issue when it comes to mental health and mental hygiene is, one, we've allowed this war against us go on for way too long that we are being overrun. So it's very challenging for us to hold the line from law enforcement to providing services. Because typically, yes, our doors are open and we'll see you same day and we'll try to get you in as fast as possible. But the need is very high. The amount of people that do come in, which we're lucky that they do come in, to be able to withstand, and as you stated, the census. So we're talking about, let's say roughly for us in our clinic, we're talking about 35 clinicians overall. And last year alone, 40,000 people came in through our doors. 40,000. And that's 35 clinicians, give or take. And that's what we're facing as providers. I'll say for me, we got to play the long game. So I would say in terms of the long game, hopefully the policies will be able to slow down something, whether it's bail reform whether it's the accountability piece. And I think in terms of long game is investing in our youth. I think winning the hearts and minds of our youth and really redirecting them and really bridging the gap, because unfortunately, this is gonna pass my generation. It's gonna pass a lot of our generations, and we're in this for the long haul. That's just because of just how wide open the border is, as you stated. I served 2 tours, and I seen this in Afghanistan, and the streets here look a million times worse than what I saw in Afghanistan, and they produce 95% or 98% of the world's opium. And it's fascinating to a large. It's fascinating, but at the same time, what we're facing, it's gonna take us sitting like this, but across the every state and every county as well. So, but the youth, and that's why I say winning the hearts and minds of the youth and really redirecting them and really showing them the importance of why not get into the fentanyl. And it is literally a weapon of mass destruction, as you stated.
Thank you for sharing those thoughts. Now, from the hospital's perspective, you probably had to retool some of, emergency services and the like.
Yeah, well, we think we've always played an integral role in treatment and recovery, and we have an inpatient unit. We opened a residential unit for longer term, 3 to 6 months, a few years back, and we see thousands of patients in our outpatient clinic. But the one change I've seen in my many years is, while our focus is still treatment and recovery, harm reduction has unfortunately really become what we've had to focus on, whether it's in our ED and giving fentanyl test strips and Narcan in our primary care offices, our OBGYN offices, certainly in our outpatient programs. So we've really focused on getting those things to the people in the community, whether it's somebody who uses or somebody else, family member. It's extremely important that those tools are available to everybody. We really focused on that. But as far as emergency services, certainly since COVID, every hospital has been overwhelmed in the emergency rooms. We try to do the best we can when patients come in with either an addiction or, if they've overdosed, we try to get them to a peer service right away. So we can connect them to all our services. Our outpatient sees them. If it's on a weekend, the next Monday, we keep open slots for those kind of emergencies.
Do you have any follow-up to that?
No, I think what everyone's saying is right, and that the policy piece is huge, and the hospitals, everyone's pivoting. One piece that I'll maybe share this with Nolan, and with all respect to our men and women in law enforcement, our paid professional firefighters, but when you're looking at probably 80 or 90% of our EMS and first responders are volunteers, it gets more detrimental because these are men and women who places in the outskirts in the rural areas where these houses are. And I'm sure the sheriffs could tell you there's, a house that's been, questioned right over here, just in the Chautauqua Lake School District. You go to one of these houses, this is a man or woman or a teenage 18-year-old that's just so excited I was an EMT. And now they walk in and they're exposed to fentanyl or harmful, another harmful chemical. I think, that it's even more potent. One of the things I've heard, and I've been pivoting to this, and I think if there's anything we take away from today was a quote that's been used recently, and I think we're all in supportive of this, is the best time to plant a tree was 25 years ago. Well, the best time to fight this war would have been 25 years ago. The second best time is today. And I think that's what the commitment we have. I know Steve's been part of it. Our law enforcement, mental health community has been part. But today is where we need to leave here and make a stand. Now, I'd love for the county to be able to change a law to say, change the weight. Like supporting exactly what you said, Congressman, that, if 2 milligrams can kill, then 5 milligrams should be an automatic felony, not 19 pounds and questioning. I mean, this is ridiculous. But again, I can't say enough of everybody in this room. What you do every day is phenomenal. And I think the other side, we need to focus on the good things, because there are a lot of great things and a lot of great treatments and a lot of great success stories that are happening. I went to drug court in Dunkirk last year, and just there are successes and people that praise the work that's been done. But again, we need to keep up the good work.
Any thoughts from any of our county legislators? I want to give you the opportunity to.
I think that obviously the enforcement is simple. The borders, the bail reform, it's common sense and it's simple. The difficult is the recovery and the mental health and I think that's simple too. We do target towards the youth and what Dr. Falk said and Lacey said that poverty is a huge part of it and socioeconomic standards and the environmental factors that lead into it. I think that's where we can, as the legislature, affect the most change at the local county level. We can't write laws to change ways like PJ said, but to support our human services and our health department and doing what they do and the other organizations that are cropped up with Kim, what she said and what she does. That's where we have to, I guess, our main focus, obviously supporting our law enforcement officers too.
I agree with what Mr. Proctor said. I have a 18, 19 and 21-year-old at home. And I have to give the public schools a bit of credit because through education, they have taught my kids in a public school that pretty much everything is a drug. Sugar, insulin levels and so on and so forth. Health, a balanced diet, but they've also broken an arm or leg or two. I didn't push my crowns. And they go to the ER, every single person asks them, what's the story? What happened? So my littler one, he went on and on at length. The story was quite long, so he had to repeat that all day when we were there one time. But I told them when we arrived, I gave him Motrin to calm down the inflammation and calm him down. And Justin's reminding me, Mom, that's a drug. You gave me a drug. Well, I just told them I gave it to you guys. So they have learned that everything from an aspirin to a sip of beer to anything is a drug. So if you don't want to get, they call all of the drugs entry gateway stuff. So they came up about that, their own public education. I'm sure if they took that away, there are a lot of other students that are younger are also taking that away.
Yeah, sure. It's really great to see all the people in this room today that showed up and are actively working on this. There's a lot of people that are missing here today too, that are still actively working too, and that's really great. We have a lot of community partners, a lot of agencies, a lot of different people at the table today, and that's really great. That's what we should be proud of the work that we've done this far. There's always room for improvement, and that's why we're here today too. We can all do a little better. Well, we've identified some things that we can improve on today. We've opened some new avenues, and I know that we all want to do better. We just need to know how and when, and that's why we're having a roundtable. I think on a federal level, we know a flow issue. We know where it's coming from. We need to stop that. Even on a federal level, some of those people that are those trafficking devices sometimes get out of these charges as well. We need to be able to prosecute and hold people that are accountable. Education is really key. I agree with Carmelo in the sense of educating our youth, and I think that's one of our best tools is trying to combat it in a way of education and trying to promote the youth to not have an interest in it and even go down that road. Some are going to go down that road, and we're going to have to play that long game. But being able to keep the people in the doors. We have a facility that can treat, but not the people in there to treat. We have space, so we need to figure out how to get the people there and keep them there. Maybe they show up, but they don't come back. As part of a legislator, part of my job is to speak up to other officials above me to help figure it out. One way is we need funds. Specific grants to fight the fentanyl fight. I'm sure the sheriff's office, if we gave him extra money to hire prosecutors, hire someone, investigators, more specific, we have people in the room that are doing a great job. They could use more help. They could use some specific funds. Same with the public health. Funding is big, and if we had some more federal funding, I think that would be very beneficial and well utilized. We have the research going on a long time. I think being able to utilize those funds is important too, but collaboration is key.
Well, so we start a conversation here today and we need to keep it going.
Did you? Sure, absolutely. Certainly collaboration is exactly where I was going to start, Dan, and it obviously starts at this table, but I think that there has got to be an answer for, how to collaborate within other counties. I mean, everyone is seeing this. There are solutions that other counties may have that we haven't investigated yet. Certainly prevention, Melanie, prevention is number one, Dr. Paul. Getting them at a young age. But of course, my heart is with law enforcement. My husband spent 23 years as a law enforcement officer, and the problem has always been there. This is not really a new problem. It's just, it's obviously metastasized itself, into a larger problem. So the problem's always been there. And we just need to get our arms around it and collaborate with other agencies and counties and solutions. So
thank you very much. We didn't hear from our fire department or emergency services, or you got talked over. I just wanted to open the floor if you had any final closing thoughts here.
Go ahead, man.
Again, what we do with fire in conjunction with law enforcement and with EMS, it's a problem that affects everybody. From the fire side of things, we do have an old housing stock, and it does contribute. People fall asleep when they overdose. It does contribute to the fire burden, and also contributes to the instability of neighborhoods that also drives those problems. Law enforcement helps us do board ups and to secure properties so people don't get into them. You have to keep going back and sweeping through all of these properties with us. So it's not just the overdose calls that we respond to, it's also these other things that contribute to it as well. From the emergency medical side, it certainly helped to drive our call volume up exponentially. And just like we've talked about at this table, it's certainly not a problem that we can foresee going away anytime soon. So we do have the tools to fight it. We will continue to do what we can do at our level to, certainly prevent needless deaths from overdoses and try to be as quickly as we can to respond to those emergencies and to get people breathing again. So hopefully they can get into a treatment program and certainly do the work they need to do to help themselves.
On an average day in Jamestown, how many times are you called with an overdose?
It's been an average day, 5 to 7.
Staggering.
And a lot of repeats, as we previously discussed.
A lot of repeats. When we did this actually no, I was just at the Elmira Fire Department, because they got a grant, and they had been on they had delivered Narcan 3 times that day already. And they said we could tell a hot dose has come into town because the numbers were spiking.
That's a very true statement, even for the city of Jamestown and the territory that we protect. You can always tell when something has happened that's created a vacuum and then another source comes in, and it's usually more potent than the previous one. Not always, but it does have a lasting effect.
It just shows you all the reason that just the different agencies all have to collaborate and communicate and work together. Because information is power in this circumstance.
It's become frontline training. In Chautauqua County, I have 42 fire departments, 39 volunteer, 2 full-time career, 1 combo. And, some departments don't do a lot of EMS, but it's become the training for Narcan has gone not just to the EMS providers, but to every firefighter. It's really become a frontline aspect of every fire department of having, not just the people who do hands-on care, but and a lot of it's, okay, if I'm firefighting in this house and I get exposed, I need to be able to take care of my, fellow firefighters. And it's, so that even to that level, it's reached a lot. But as you just mentioned, when you listen to the radio calls, you can always tell when, okay, there's a bad round coming, because all of a sudden all these departments are just going out all at once. are all, right close to each other, and you can see it that those clusters hit, and it's very evident.
Joe Pena, the Senate candidate, will constantly say that in August, we had an incident where how many firefighters were sent to the hospital for, it was a house that caught fire that was a known drug house, and they were exposed. I mean, we had 10 firefighters. That could have been 10 fatalities in one day and one fire that nobody would have expected. So luckily it worked out well, but as Will said, it's happened to us. It's scary. Yeah.
Anyone have any thoughts that they didn't get a chance to? I want to make sure everyone feels okay with it.
Can I just speak to the actual bill for a second? So my role with the Chautauqua County Narcotics Unit is I'm a liaison with the DEA out of Buffalo. So when we charge someone federally through the county, I'm the liaison for all those charges. The reason why this bill is so important is because fentanyl itself is a Schedule II controlled substance. So it's there. The problem is by changing a few molecules on fentanyl, you can have many forms. They're called analogs. Those analogs are not scheduled controlled substances without this temporary or it being. So there are certain cases that we might not be able to prosecute because we see floral fentanyl or different kinds of fentanyl that wouldn't be considered a controlled substance if this bill doesn't continue through. So that's why this is so important, is because there's ways around. It can still be as potent as fentanyl, but it's not actually going to be listed as fentanyl on the labs that we get back from the testing of the drug. So that's really why this bill is so important. And there's a lot of cases we could actually lose out on prosecuting if it's not passed through.
Excellent point. I mean, this shouldn't be controversial. I don't know why we haven't seen action.
I underscore just that point. 30% of our deaths in 2023 and it's unknown fentanyl analogs, according to
So minor chemistry changes, just as deadly or deadlier, but not classified the same way. And you can use K. A major peddler can walk. That's the danger. We want to make sure that our prosecutors have all the tools that they need to help clean up the streets. Any other thoughts, sir?
More than our time. I think maybe relative to the bill itself, I'll just sort of advocate for the need for the support to do the testing, etc. So law enforcement, and really from a public health point of view as well, we could really benefit from timely data on the drug supply in the community. Most people that die in our county of fentanyl poisoning have ingested it with a stimulant. So as the sort of the landscape keeps changing on the ground, it's really helpful to know that in real time. Just a specific request that the changes in the bill would also come with support to be able to back up the data that we need, the information.
Very good point.
You may be planning on, summarizing,
No,
but I'm going to just, from what I've gathered here, in some of these I had written down before, but really our dealers need to be held accountable. Kim mentioned it, the chief mentioned it. We can't be continually releasing them. As a consequence of our bail reform, this is a consequence I wasn't expecting, but many of the people who are coming to our jail, those who are the users, they're not coming to the jail, so they're not getting treatment. Unfortunately, the jail has been a place for individuals to get treatment. So many will say, when you ask them who are their primary care provider or the mental health provider, they mention those who are working in the jail versus somebody on the outside. And as the lieutenant had mentioned, is we see a lot of laws being passed that are intended to help certain groups of people or different individuals, which in fact end up hurting them. And I think that's a direct consequence of our lawmakers, as I look at the congressman, not doing what you're doing here today. They're not communicating. They're not talking to the people, the boots on the ground, to find out how will this law impact your community? How will this law impact those around? I know when I found out Investigator Bucket was going to be here, I jokingly, well, probably seriously said something to the lieutenant. I says, yeah, we need people here that know what they're talking about. And, just that couple minute explanation really helped me to understand the law a little better, but I appreciate that. And, one of the things that I learned in, when we talk about the border counties in the border crisis is so many people are looking at those crossing our southern borders. It's coming from Mexico, coming from Central America. Talking to some of the border county sheriffs, we're having hundreds and thousands of people coming from China, crossing that border, bringing in the fentanyl in. So it's not just a small cross section. Matter of fact, I believe it's Cochise County. They're seeing no Mexican people crossing the border. The majority are coming from China. And so you have to take that into consideration. And then the last two things is, and I think we really need to be able to incentivize people to get the treatment, to encourage people to get the treatment. And I've been saying for years, when we see the drug epidemic, it really stems from a lack of hope. We have to be able to offer the hope to individuals. There's a great studies out there on the science of hope. There's a lot going on with that, but if we can reach the individuals, the young people, the family members who are also victims of this, we have to be willing to reach out. And so, Congressman, I really applaud you for reaching out to the stakeholders. And that's what we need to continue to encourage, our lawmakers in Albany to do, and lawmakers across this country to say, how can we help you? How can we help your constituents out there?
Well, thank you, Sheriff, and thank you for helping assemble this, and thank you, County Executive, and everybody that took the time today. I mean, when you get elected to public office, you're expected to have all the answers. Well, I know I don't have the answers. I know that you have the answers on this topic and many others, because you're on the ground fighting the fight every single day. You're the people that are responsible for keeping our community safe, and it's important for me to have these dialogues on this topic and many others, so we have the facts from the community as to what's going on in real time. So I hope that today served as it was excellent, from my perspective, in terms of hearing directly from you, your perspectives on the fentanyl crisis, the solutions. Obviously, we need help with the criminal justice system in Albany. But in some other perspectives that I'll take, to the federal level. But, these dialogues help me be a better representative for this community. So I'm going to continue doing this, across my district. But we have to keep this fight out in the open, in the forefront, and we can't stigmatize it. We need to get help for the people that are stuck and crippled by addiction, and we need to go and have proper enforcement against those that are profiting off of that same addiction. And hopefully, we'll get some people around this state to wake up and understand the error of the ways of the destruction of our criminal justice system, so that our men and women in uniform and our prosecutors can go and put real penalties on the people that are bringing this to our streets, that are trapping people, in an endless cycle of addiction that we have to get them out of. So I really salute everybody. Thank you very much for taking the time to be with us. If you have any other thoughts, we have an open door. I have district offices in Clarence, Jamestown, Olean, and Corning. I'm around here pretty often. County executive can tell you we spend a lot of time on the phone. But any thoughts that you have along the way, or things that you think that we should be aware of, please reach out. They got a wide open door, and really appreciate to have the working relationship with all of you. And together, we need to work together to make the future brighter every day. So thank you very much for being with us.
Yes, sir.
Any questions?
You just want to summarize for us, what are the bills that you're opposed or
I'll even do you better. I read the dialogue on that, but we'll give you the full printout, so you get the bill numbers and everything as to what we've been working on. I mean, just basically any package that we've put forward that would put more teeth at the federal level to this. I mean, that not every state has the criminal justice problem New York has. It's becoming more of kind of two tiers in this country. I mean, most states have a common sense criminal justice system. New York, California, now Illinois. I mean, when you scrap cash bail, you eliminate consequences. That hampers our ability to enforce. Putting teeth to this, and especially what Investigator Bucket, put forward about the molecules of fentanyl and the changing, dynamics when you're dealing with chemicals. A little difference in the compound makes all the difference on the prosecution. And it doesn't make it that it's probably even more poisonous than the original when they change the molecules. They're not making it lighter. They're making the high, quicker and more addictive. And that's why we have to stay one step ahead. I mean, we're in a war with a for-profit entity. This is not some ragtag bunch of, Mexican drug dealers that some, have in their head. I mean, this is a multi-billion-dollar conglomerate at this point. They have assets and they have scientists and they have, all sorts of abilities to stay one step ahead. We have to take it that seriously.
On behalf of the residents, I'd like to thank the congressman and his staff for being here, for putting this together. And again, Congressman, thank you so much for all you do. And
my honor.
We definitely are behind you, and all of us together here, we will continue our work. And I just like to, again, on behalf of myself and the residents, thank you for all you're doing. Thank you for spending time with us today.
Thank you very much.